Hello, this is Danny Peterson, a senior resident in emergency medicine at Western University in London, Ontario, Canada. I've joined Dr. Rob Arntfield, who is an assistant professor at Western University in the Division of Emergency Medicine and the Division of Critical Care, in creating this screencast. This is part 2 of the module on assessing left ventricular function at the point of care. This module will focus on the parasternal short axis when determining left ventricular function. Let's start by briefly reviewing some important concepts from the previous section. The ability to ascertain left ventricular function during shock states is of vital importance. This skill is an essential part of any bedside ultrasound protocol, such as the rush exam, when determining the etiology of shock. This skill is also useful when monitoring the effectiveness of mechanical or pharmacological interventions. As discussed previously, the eyeball method of determining qualitative measures of left ventricular function are preferred for the emergency department or ICU, with more quantitative measures being both impractical and unnecessary. Again, we will be using the 4 categories: normal, hyperdynamic, depressed, and severely depressed when making our assessments of left ventricular function. The parasternal long and parasternal short axis views of the heart are well suited for assessing the quality of function of the left ventricle. While the parasternal long axis view may not be intuitive initially, the parasternal short axis view offers the sonographer an echocardiographic cross-section of the heart that is easily recognizable. This cartoon image clearly displays the relevant anatomy when viewing the heart in the parasternal short axis. The left ventricle is the thick, circular ring of cardiac muscle with the central cavity seen here. Although there are several levels at which the heart can be viewed echocardiographically in the short axis plane, we will focus our attention at the level of the papillary muscle when making our assessment of global LV function. The papillary muscles are seen as 2 nubs of muscle protruding into the left ventricular cavity, as seen here. The interventricular septum, observed here, divides the left ventricle from the right ventricle, with the cavity of the right ventricle forming somewhat of a thin-walled crescent shape, as seen here. Lastly, the pericardium is seen to surround the heart and is easily recognizable in both the near and far field. This slide displays the cartoon image briefly superimposed on an actual echocardiographic clip of a heart with normal LV function. Obtaining views of the parasternal short axis begins with obtaining an ideal view of the parasternal long axis of the heart as described in the previous section. Since these views are orthogonal or 90 degrees to one another, obtaining the parasternal short axis simply involves rotating the probe on the chest 90 degrees so the index marker is pointed toward the left shoulder of the patient. This results in an echocardiographic view of the heart that is cut along its short axis, which is essentially a cross-section of the heart as seen on this cartoon. This video shows some basic motor skills and movements required when obtaining the parasternal short axis view. From your optimized parasternal view, the probe is rotated 90 degrees on the chest wall, so the index marker is directed towards the patient's right shoulder. The thick circular ring of the left ventricle should come into view at this point. Optimizing this view involves small rotational movements to ensure that you're obtaining a true cross-section of the ventricle that results in a nice circular structure, as opposed to an oblong or oval-shaped structure. Once the circular left ventricle has been optimized, small movements or tilting of the probe is performed to focus your view at the level of the papillary muscles. If you find yourself struggling or have lost any recognizable structures, simply return to your parasternal long axis view and start again. Remember, small, slow, controlled movements are the key to optimizing image quality.